The Oregon Association of Nurse Anesthetists represents approximately 300 certified registered nurse anesthetists providing anesthesia services in the state of Oregon. Nurse anesthetists are extensively trained anesthesia specialists who administer anesthetics for surgical, obstetric, and other perioperative or pain management procedures.
Nurse anesthetists are able to provide cost-effective and safe anesthesia care because of their educational background. We start out as bachelor-prepared nurses. We are required to have ICU experience. Most anesthesia providers have at least 4 years before they go on to a master's-prepared residency program. We specialize in all different kinds of anesthesia, including rural health, pain management, pediatrics, obstetrics.
Our history of anesthesia care services to the citizens of Oregon dates back to the late 1800s. Our first formal educational program for nurse anesthetists was established in 1906 in St. Vincent's Hospital. The Oregon Health and Science University School of Nursing Nurse Anesthesia program admitted its first class in 2006 and graduated the first cohort in December of 2008.
I'm a student nurse anesthetist. I'm a member of the third graduating class. The program in this area is very advantageous to the whole state of Oregon. I come to Oregon from Louisiana, and many of my classmates come from different parts of the country. And a lot of my classmates have gained employment in the Oregon area, and they plan to stay here for the long term.
One of the hallmarks of Oregon is it is an opt-out state. What that means is that each individual hospital can determine how nurse anesthetists function in their facilities.
In the United States, nurse anesthetists provide about 2/3 of care to all rural patients. This is very important because these patients otherwise may not have access to anesthesia care services.
As a rural nurse anesthetist, I work in a critical access facility which provides care to folks who might not otherwise receive those services. We're able to give trauma stabilization, obstetrical services, surgical services, as well as pain management.
We have a huge amount of rural practice in Oregon, and so there are many hospitals that have 1 or 2 or 3 anesthetists out in distant areas, and those people provide excellent care for their patients.
But the beauty of the opt-out is that it also will allow hospitals to make the determination if it is in the community's best interest to allow nurse anesthetists to practice without direct medical supervision. And I believe that's served the state of Oregon very well.
So when I'm asked to talk about barriers to my anesthesia practice, the biggest thing that comes to mind is the fact that hospitals have the capacity to limit what I have been educated and trained to do as a nurse anesthetist. I can do regional anesthesia, I can do arterial lines, central line placement, and I can do them well. But yet I can enter an institution where their bylaws prohibit me from doing such tasks.
A recent New York Times editorial called attention to nurse anesthetists' contribution and has asked public officials to look at nurse anesthesia as a cost-effective, safe, high-quality provider to reduce costs to the citizens and people of our country.
I knew that CRNAs provided compassionate, quality, cost-effective care in rural areas, and I've since learned that they provide that same quality in urban areas as well.
I think nurse anesthetists will provide vital resources and economical, safe, quality, effective services in this climate where we will see a contraction of interventional money dedicated to surgical and specialty services.
We would like to work with other organizations. We feel that, and I feel personally, that CRNAs are a great asset to the healthcare system in Oregon and one that we need to use to the fullest extent possible.
It is a fortunate patient that has a CRNA with him to receive anesthesia care. We are the hands-on nurses who provide the art and science of anesthesia.
I'm a nurse anesthetist.
I'm a nurse anesthetist.
I'm a nurse anesthetist.
I'm a CRNA.
I'm a nurse anesthetist.
I am a CRNA.
We're CRNAs, represented by ORANA since 1935, to ensure that all Oregonians have access to the high-quality, independent anesthesia services that nurse anesthetists provide. Changes in the healthcare market are long overdue, and ORANA welcomes the opportunity to work with the Oregon Legislature, healthcare associations, and healthcare providers in developing cost-effective healthcare opportunities for Oregon. The Oregon Association of Nurse Anesthetists, celebrating 75 years of service.